And so we wanted to give students interested in the field of genetic counseling or students in the field of genetic counseling an opportunity to have some case exposure and also some discussions. The second reason that we're hosting this webinar is that we at Gene Counsel are really interested in diversifying the field. And so we wanted to reach out to all students because we need really good, smart students to come into our field. But we wanted to make a special shout out to diversify the field. And so as you saw from our flyer, we're particularly reaching out to students from the LGBTQIA+ community, to anyone who is disabled or differently abled, to people of color, to men. We don't have a lot of men in the field, to people coming to our career as a second career, or who may not be the typical biology student coming to the career, but you bring other things to the field and we want you and we need you. And so thank you so much for joining us today. I want to talk to you a little bit about genetics. We call this our genetics tsunami because the field of genetics is exploding. We know that over time, there are new tests being developed every single day in almost all areas of medicine. So as you'll see, this includes things like cancer and cardiac genetics, prenatal genetics, but also things like viral genetics. A lot of genetics is being done to help us fight COVID-19. And yet, although there are more than 300 million people in the United States and millions of people worldwide, we only have 5,000 certified genetic counselors here in the United States and far fewer in other countries. So we need more genetic counselors. What does a genetic counselor do for those of you who are new to the field? Genetic counselors do many different things. There's no way I can cover everything here today, but let me touch on a few. Genetic counselors can elicit and assess family histories. So you take a detailed family history from patients and from their families. We also can order genetic testing, interpret genetic test results. So you can imagine there are many different types of genetic tests, and they need to not only be ordered correctly, but be interpreted accurately in order for that patient and their family to use that powerful information. We also provide support to families who are getting a diagnosis and need to know what to do with their test results. We can write journal articles, conduct scientific and medical research. We provide a lot of lectures to the general public. We teach in medical schools and nursing schools and physician assistant schools. We teach to students, whether it be in high schools or colleges or elementary schools. Genetic counselors can work in labs and work for companies. There are many genetic counselors that go straight to industry these days. We attend conferences, and genetic counselors today work in sales, marketing, and even in education. There are many different specialty areas, as I mentioned, including prenatal counseling. So this could be working with people who are pregnant and maybe learn that there is, when they have an ultrasound, that there may be something different about their pregnancy and they need information and testing. We can also help people who are having a difficult time getting pregnant and help them with assisted reproductive technologies like IVF and help them achieve a pregnancy, or to use donor sperm or donor egg or even a donor embryo. Cardiovascular genetics. So you may have heard of people who at a young age have a sudden heart attack. Sometimes more often than you think, that can be related to an underlying genetic issue. Cancer genetic counseling. So people who have a personal or a family history of cancer. Also pediatric and adult genetics. So think of people who may have a baby and maybe that baby has Down syndrome and they need to learn about what is Down syndrome. What can we expect in this baby's life who has Down syndrome? How can we help that baby have the most fulfilled and maximize their potential. Also, neurogenetics, things like early onset dementia or Alzheimer's disease. Psychiatric disorders. We now know that some psychiatric conditions are genetic. We also have laboratory genetic counselors and many, many more areas that I won't be able to touch on today. So who should consider a career in genetic counseling? I would say there are the typical genetic counselors like me who came to the field because I love genetics. I thought it was cool in high school when we did Punnett squares. I loved it in college. And I also liked psychology, working with people, listening to people, helping people. However, there are some people who go into genetic counseling because they love teaching. They like big data. So they like getting data, manipulating data, understanding data, and writing about it. They enjoy technology. If you like technology, there is so much room for you in the field of genetic counseling. They also enjoy growing and learning because this field is not stagnant. It is constantly evolving, and so it's something really exciting that you're always keeping up on it. There are people who go into the field because they want to help people. There are people who like genetic counseling because they like business. One of our team members, Megan Farmer, is a genetic counselor who also went back and got an MBA. And so at the intersection of business and genetics, there is a lot of room for new talent like you. Also, people who enjoy public health and want to figure out how to use genetic testing to help large populations. So I want to show you some data from the National Society of Genetic Counselors, or the NSGC. They've listed this data on one of their sites. The employment of genetic counselors is projected to grow 29% from the year 2016 to 26. And so this is a field that is growing. I will say that during the pandemic, there's been a slowdown in growth, but we're very hopeful that after this pandemic, that growth will continue as it has for several years. We also know that more than 87% of graduating genetic counselors in 2016 and 17 had a job before they even graduated from graduate school. We know that the average salary for a full-time genetic counselor, and this was in 2018, was $91,000, and it can go all the way up to about $250,000, depending on the specialty area and experience, and also the part of the country. 91% of genetic counselors report that they're satisfied with their job. We also know that genetic counseling was named one of the 25 amazing healthcare support jobs and one of the 100 best jobs in 2019. So that's exciting. So if you want to be a genetic counselor, what kind of education do you need? You need 4 years as an undergraduate, and most genetic counselors have classes in genetics or molecular biology, chemistry, psychology, statistics, and bioethics. But there are other helpful classes that you consider taking, including Spanish, because we so desperately need more healthcare providers who are fluent in Spanish. It's a real plus to have that on your resume. But also classes like sociology, in-depth molecular biology, or cytogenetics, which is the science of chromosomes. But also, and this is critically important, having experience in a counseling setting is really important. Now, that counseling setting could be that you are a teen counselor or a crisis counselor. You could work for Planned Parenthood or a similar organization and counsel people who need birth control, or counsel people in a rape crisis center. But that kind of experience is really important, and it's often done as a volunteer. It's also helpful to shadow a genetic counselor. We know that that can be challenging right now since so many places are remote, but there are some places that are accommodating shadowing a genetic counselor. And for those of you who can't get that experience, that's exactly why we're having this webinar. After getting an undergraduate education, you will also need 2 years in graduate school to obtain a master's degree in genetic counseling. Now, when I went to graduate school in genetic counseling, there were only 19 programs in the US, but now there are 52 programs in the US and Canada with such genetic counseling programs, and they're growing all the time. And so if you're thinking about this field, what can you do to really educate yourself and to learn more about the field and opportunities available to you? Well, as you can imagine, this is a question that we are asked often. And for that reason, we have developed a toolkit that's free, and you can access it at My Gene Counsel. If you can't write down this URL, all you have to do is type into Google My Gene Counsel Toolkit, and it will come up. This toolkit is extremely comprehensive. It has everything from podcasts you can listen to, articles you can read, and things you can consider when you're thinking about the field of genetic counseling. You can also go to the American Board of Genetic Counseling and to the National Society of Genetic Counselors for more information. And you can also come to our website, and specifically on our website, you can find a section called Genetic Journals, and we have a lot of stories about genetic counselors in the field, and also some patient stories so that you can really understand what the field is about. If you're interested in the field, I recommend that you listen to podcasts, that you read the books that we've listed. There are a few movies you can watch. What better way to educate yourself during a pandemic than to do some of these things? So how can you learn more? One of the cheap and easy and free things you can do is to follow My Gene Counsel and other genetic counselors on Facebook, Twitter, LinkedIn, and Instagram. And very quickly, you'll become part of the conversation and you'll really see what's going on in the field. You can also go to genomeweb.com and sign up for a free daily newsletter to learn what's happening not only in genomics and genetics, but also in genomics business. It's important for you to become part of the conversation. And so it's great for you to get on Facebook or Twitter or LinkedIn or Insta and to see what's happening, but you can comment, you can retweet, you can share, you can ask questions, and you can reach out to genetic counselors to ask them about the field. You can also become an intern or shadow a genetic counselor when that becomes easier after the pandemic. Why should you consider a career in genetic counseling? Well, there are more jobs than genetic counselors, especially in average times. The field of genomics is exploding. We need genetic counselors, and more opportunities in more areas are opening up every single day. It's a challenging and rewarding field where you can truly make a difference. And also, most of these jobs come with benefits packages. And again, let me say this again. We need men in the field. We need people from the LGBTQIA+ community. We need people of color, people who are disabled or differently abled. We need people who are coming to genetic counseling as a second career and have expertise in other areas. We also need religious and ethnic minorities to round out the field because we have patients from all of these groups. And we know that having a more diverse genetic counselors will help the entire field. So we need you. I now want to go into the case presentation part of this lecture. We're going to talk today a little bit about hereditary cancer. Of all people who develop cancer, only about 10 to maybe 20% in some areas have a form of cancer that actually gets passed down in families. You may know that Angelina Jolie came out a few years ago in a letter to the New York Times saying that she knew that she carried a mutation in the gene called BRCA1, and it put her at high enough risk to develop cancer that she had both of her breasts removed preventatively and later had her ovaries removed preventatively, and she has not developed cancer, likely because of those decisions. And so I want to talk to you about the genetics of cancer. These are the chromosomes of a female, and this would be in one cell of her body. So if we took a blood sample and looked at one cell under a microscope, these are her chromosomes, and you can see that they've been arranged into pairs. As you may or may not know, the average person has 23 pairs of chromosomes, and they either have two X's, as this person does, or typically they have either two X's or an X and a Y. This person has two X's and is therefore female. We're not going to be talking about genetics on the chromosomal level today. We're going to be talking about it on the mutation level. So a mutation, for example, within one of these chromosomes. So the mutations that we're going to be talking about today, BRCA1 and 2, are passed down in families in a pattern called autosomal dominant. And so what I'm showing you here is a pedigree or a family tree. All of the squares on this pedigree stand for males, and all of the circles stand for females. This line between them represents a couple, and these lines down represent all of their offspring. And so you can see that this person is circled in because this person carries a mutation or a genetic change, let's say in the gene BRCA1. And so what that means is that that person with each pregnancy has a 50-50 chance of either passing on the chromosome that carries the BRCA1 mutation or the chromosome that doesn't. So you can see that this child is not colored in because she didn't inherit the BRCA1 mutation, and therefore she can't pass it down to her children. But this person did inherit a mutation, and so she can pass it down to her children, and her brother, who also inherited a mutation, can pass it on to his children. So we're going to quickly talk about BRCA1. It's a gene that's called breast cancer 1, and all of us have two copies of the BRCA1 gene, one on our chromosome 17 from our mother and the other from our father. If we inherit a mutation from either parent or we have a new mutation, we're at increased risk for breast and ovarian or prostate cancer, depending on whether we're male or female. There are thousands of mutations within BRCA1 that can increase our risk to develop cancer. There's a second gene called BRCA2, which is located on a completely different chromosome. And we know that people who inherit a mutation in this gene are also at increased risk for several different types of cancers that you see here. So I want to talk to you about a few case examples. It's important for you to know that we've changed all of the names and all of the identifying information here, but these are cases that we really saw in practice. And so, for example, in this family history, this woman was diagnosed with ovarian cancer, and her daughter was diagnosed with breast cancer. They had actually been referred to genetic counseling 5 years before their diagnosis because the grandmother, can everyone mute themselves, please? I can hear some background noise. Thank you. We know that the grandmother was diagnosed with breast and ovarian cancer at age 50, and her mother had been diagnosed with breast cancer and died of it at age 56. So this family of Italian ancestry had been referred for genetic counseling before this mom and her daughter were diagnosed with cancer. But they made the appointment and they got scared about having genetic testing and they decided not to come until a few years later when, in the same month, they were both diagnosed with cancer. This woman chose to have a lumpectomy, which means she had part of her breast removed. She had chemotherapy and radiation to treat her breast cancer. And this woman had ovarian cancer. They both had genetic testing, and we learned that they both carried the same genetic mutation in the gene called BRCA2. We were then able to test this woman's child when she turned age 21. She chose to have genetic testing and learned that she doesn't carry the mutation that was found in the family. So she had an average risk to develop breast, ovarian, and these other cancers. Her brother, who was age 25 when he was diagnosed, learned that he did carry a mutation. And so he's able to have surveillance at an early age before he develops cancer to hopefully reduce his risk of ever getting cancer. This is another family. This patient, named Marcy, and again, these are all pretend names, was diagnosed with breast cancer at age 35. And at age 38, a few years later, she got a new oncologist or cancer doctor. And her cancer doctor said, "Have you ever had genetic testing?" And she said, "I haven't, because I am the only person in my family who developed cancer. I did develop it at a young age, but none of my brothers and sisters have developed cancer, and I've got no family history of the disease." You can see that she does have a mom who at age 69 was cancer-free, and there was no family history over here of cancer. And her dad, unfortunately, died at 70 of a heart attack. But because she was 35 and developed cancer at such a young age, we did do genetic testing and found that, in fact, Marcy carried a mutation in BRCA1. We then tested her 69-year-old mother, and she didn't carry a mutation. She likely inherited this mutation from her dad, and because her dad had no brothers and sisters, and therefore she had no paternal family history that included aunts, cousins, more relatives, it's just likely that this was a small family and that we didn't have enough family history to see that family history of cancer. And so those are two of the cases we wanted to explore today. I also wanted to encourage you to follow my Gene Counsel on Twitter, on Facebook, on LinkedIn, and on Instagram to be part of the conversation. This is our first one of these conferences. I think we'll have more because we've had so much interest. In fact, there are about 200 of you on the call. And so I think what we'll do is see if there are some questions that we can answer. Caitlin, are there any questions from the audience that would be appropriate for us to answer here?
Let's see. When dealing with multiple types of cancer within the same family, is it standard to depict the different types? Sorry, that was my cat. Depict the different types as pieces of the pie chart as shown, or is the notation up to the genetic counselor?
That's a great question. And so at our program, when I led the program at Yale, we had standard pieces of the pie that we would say upper right quadrant circled in means breast cancer, lower left means ovarian cancer, but that was really just for our program so that all of the genetic counselors were on the same page. But different programs use different symbolism for cancer or for other genetic diseases.
In the second case, did you test the rest of the siblings?
So yes, in the second case, we did offer genetic counseling and testing to the rest of the siblings because even though they hadn't developed cancer yet, of course, if they were at high risk or if they learned they carried a mutation, there were things we could do to reduce their risk of developing cancer. And so several of her siblings learned that they also carried that mutation and just hadn't developed cancer yet.
So BRCA has been in the spotlight of many case studies I've seen in genetic counseling seminars. What are some other common genes that genetic counselors will see in their line of work?
So we've been talking about cancer genetics today. Keep in mind that there are many other areas of genetics, and BRCA1 and 2 are just two of the genes in cancer genetics. There are about 20,000 genes, so there are a lot of them. Other genes that we commonly see in cancer genetics include 5 genes that are associated with a syndrome called Lynch syndrome. And Lynch syndrome has to do with hereditary colon cancer, uterine cancer, ovarian cancer. There are also many other genes associated with breast and ovarian cancer, but also things like medullary thyroid cancer or colon polyps. If you're interested in seeing some of those other genes, you can go to the toolkit that we listed for you, and some of those other genes are highlighted.
Where do you get information for family history? Do you let them self-report or do you use medical records?
Fantastic question. We usually do both. So we ask people about their entire family history, whether it be of cardiac disease or cancer, or it could be a different kind of syndrome. But we also like to get medical records so we can verify some of those diagnoses in the family, because sometimes people either don't know their family history or they're confused about it, and the medical records help verify.
How would you counsel a patient that's on the fence about receiving genetic testing for hereditary cancer if they have a family history?
That's a great question. Genetic testing is not for everyone. And so in an ideal setting, we like to meet with people before they have genetic testing to really go over the risks, the benefits, and the limitations of testing so that they know what they're getting into before they have genetic testing. We would talk to them about some of the pros would be things like, if you know ahead of time, or even when you have cancer, if you know you carry a mutation, we can do things to either treat your cancer more effectively or to reduce your risk of ever getting cancer. It can also be really helpful to your family members. On the con side, there may be people who having genetic testing right at that moment isn't the right decision for them. So think of a 19-year-old person whose current risk for developing cancer is low, but maybe the emotional risks of having genetic testing at that moment, it doesn't pay off for them to have testing, and they might want to wait a few more years until they are in a better place emotionally, or even to have insurance, health insurance, and have testing then.
Ellen, if you don't mind, I'll jump in and take one for you. The next question is about Angelina Jolie and how she brought awareness to the field. But the question is, were there any minuses that happened to this type of celebrity awareness about genetic testing? And when we were in clinic, Ellen and I, we saw an overnight increase in the number of calls for genetic counseling and testing because of that awareness that happened, and BRCA really became a household name. At the time, this was several years ago, there were really some fairly strict criteria in terms of who was able to have genetic testing. You had to meet certain thresholds in terms of ages of diagnoses in the family, the number of family members, their degree in terms of how close in relation they were. And so those were limitations in terms of who we could offer testing to. And many of those still apply today. However, because testing has gotten so much more widely available and also come down significantly in price, today there are many more options to offer testing to a wider population, even those who are kind of curious about their genetics and what their risks might be. But there are pros and cons to having genetic testing without some of those kind of standard risk factors.
Thank you, Danielle. So I can see the questions now. One question is, how does a genetic counselor approach creating a pedigree when there's little to no family history? And we see that sometimes. Some people don't know anything about their dad's side of the family or their mom's side of the family, or they're adopted and they have no information at all. And so in those cases, we just piece it together as best we can. And we also sometimes have to advise people with no family history about more general genetic testing that may be available to help them sort out some of their risks. You've mentioned that getting into the conversation in social media is a good way to get exposure to the field. What would you say that prospective students have to contribute to the conversation? I think that's a fantastic question. And as a prospective student, you do have a voice. And so if you're reading an article and you find something interesting, you have a voice. You're able to say that you found this interesting, or you can ask a question and say, what did people think about this? The same kind of questions you're asking today. So don't be afraid to jump in. And Danielle, Megan, if you want to answer any of these questions, feel free. The next one is, how easy is it to switch specialties, if at all? Megan, would you like to answer that one?
Sure. I actually, in the past, worked at an institution where people took part in multiple specialties. So they might see prenatal patients one day, pediatric patients in another, and then over time, just to kind of keep up their excitement with the field, might switch. Or sometimes people need to make a career change just based on a move. And the nice thing is all genetic counselors have to do continuing education where they keep up to date on the literature, what's going on with testing and new discoveries. We have to do that anyway, just to keep up our board certification. So if you're thinking about switching to another area, you could seek out educational opportunities in that other area, or you could read journal articles about kind of that other specialty you're interested in. Genetic counselors are really adaptable, and in general, we love to learn. So lots of people end up doing multiple specialties over their career.
That's a great segue into the next question, which is about keeping up with new developments in research in genetic testing. And so as Megan said, we have continuing education credits that are required to recertify. And then there are lots of reading and research that we'll do for individual cases. There are general journals that we'll read every week or every month as they're published. And then there's conferences that occur every year, whether it be the National Society of Genetic Counselors or some of the other genetics or more specialized groups. There's a Heart Rhythm Society conference. There's one focused on oncology. There's others in the prenatal space. So they really can get very specialized in different topics. And then
oh, I'm sorry, Danielle. I was just going to say many institutions also have case conferences on a weekly basis where you get together with all your colleagues and talk about your cases, and you can learn a lot that way. The next question is, I'm wondering what you would say is the hardest or most taxing part of being a genetic counselor. Megan, how would you answer that?
I think sometimes it's the kind of emotional burden, which I think some people have brought up. So genetic counselors should approach cases with a lot of empathy and try to sort of put themselves in their patient's position. But oftentimes people are coming to you in really difficult situations. Maybe they're dealing with cancer or pregnancy loss or a new diagnosis for a child, or, even trying to figure out what a diagnosis is for a child after many years of different doctor visits. And when you try to put yourself in someone's position so that you can best help them, it can also take a significant emotional toll. And I know some of you have actually asked about that in the chat as well. So there's a good bit of literature out there on kind of burnout in genetic counselors and how to avoid it. So making sure you're doing good things to keep your mental health up, talking to your colleagues, seeking mental health counseling yourself to try to make sure you're not taking some of that home with you and you're still ready to help the next patient.
The next question is perfect for Danielle. Danielle, how does technology and genetic counseling, how can those two fields be integrated?
Yeah, I love this question. So it certainly wasn't on my brain when I went into the field of genetic counseling. I went into the field for many of the reasons that Ellen had mentioned earlier, kind of a love for science. But when Ellen and I founded my Gene Counsel, it was really a technology company. So we created a digital genetic counseling platform where we provide a living lab report. So we take that static PDF that so many patients get, and we've turned it into a series of questions and answers that patients and clinicians commonly ask about a genetic testing report. And we provide that digitally to patients and their clinicians. But then importantly, we update that over time and we push those notifications out to patients so that they can get them on their phone, in their email. They can know what's changed to best provide, to make better medical decisions for themselves and also for their family members, so that they have the latest and greatest information about their own condition at their fingertips. So that's an example in terms of how we use it in our day-to-day in terms of my Gene Counsel, but there are so many other ways that technology is now being used with genetic counseling. There's digital platforms that use face-to-face genetic counseling to do telehealth. There are also software platforms that take a picture of a child, let's say, that's suspected to have a genetic condition, and look at the different features of that child's face to help provide suggestions for what the diagnosis might be. So there are a slew of technologies that are being developed and that will be developed. So this is definitely an area of a lot of crossover and a lot of potential.
Absolutely. How do you become specialized in a type of genetic counseling? Is it more schooling or where your clinical practice takes place or some other way? Megan?
I think the answer is yes to all of the above. So sometimes there are additional fellowships that you can do. So I actually met Ellen and Danielle back when I was a student because I wanted to learn more about cancer genetic counseling and did some kind of specialized training there. But other times it really is just kind of through your focus while you're working and doing the best you can to learn more from colleagues in the field, conferences, things like that.
Do you have any recommendations for getting the genetic counseling experience or the counseling experience preferred by programs for those of us applying this fall with all of the COVID setbacks? Danielle, Megan?
I've actually heard from some newer students and genetic counselors that there are some crisis text lines where you can actually text message somebody for crisis counseling. So I would imagine that's something that can be done from home. A lot of the phone crisis counseling hotlines, you may have to do some training in person. I'm sure that they've developed ways to do that safely, but then that may be done from home potentially. So I would say look into your typical avenues, and I'm sure those programs have had to adjust.
I think that's a great point. And I imagine during this crisis, there's more counseling needed, not less. So perhaps reach out to those organizations.
I think it's also good just to touch base with the genetic counselors that are close to you. Some of them are starting to open their clinics, although many of the shadowing experiences are still being pushed off based on exposure risk. But you could offer your services in other ways or your expertise to do projects from home remotely. So there may be opportunities for those who can get creative and who have people who are receptive to those types of projects. So I would say continue to reach out, touch base with genetic counselors in your area or really across the country. If those in-person options aren't available, there could be remote options for you.
I know some people and other medical professionals say that patients appreciate getting emotional with their patients during stressful medical outcomes. Is this something you feel is appreciated by those coming for genetic counseling, or is it seen as unprofessional? I can take that one. I think it really depends on the genetic counselor and on the patient and on the clinical situation. I think that most of us are taught as part of our counseling training that being able to be there and being the support person for the patient and the family is really the goal. So if you broke down and cried during the session, that's usually not terribly helpful. But I think it really depends on the counselor, their own personal style, and also on the situation and the patient. Danielle, Megan, I don't know if you have anything to add there.
Yeah, I think it's going to be really situation dependent. So if it's a patient that you're meeting for the first time, you're still building rapport and building a relationship with that individual. But if it's a patient who you've known, over the course of 10 years and, they're coming in or calling to tell you about, a sad or a new diagnosis or something, of course, you have a relationship with that person already. And so it's going to stir emotions, and, you can judge each of those interactions, and kind of take your best judgment to each of them.
There are several questions about volunteer experiences. So I think we've talked about that. And I would say reach out. If there's someone on LinkedIn or on Twitter that you see, reach out to see if you can volunteer any services you have available in a counseling setting or even genetic setting. In the second case, why did you propose that the father is the origin of mutation? Although none of the grandparents had suffered, why didn't we consider the chance that it could be germline or de novo? So that's an excellent question. So in that particular case, we felt it was most likely that the mutation in that family, which was a founder mutation, was not a de novo or brand new mutation, and that it was most likely inherited from the father's side of the family. We encouraged that family to contact the father's more distant relatives to offer them testing in case, in fact, that was true. We also know that because some of the siblings tested positive for the same mutation, that if it were de novo, it would have been de novo in the father. It had been passed to other siblings. How do genetic counselors feel about commercial genetic testing? How do you address someone who comes in with commercial results? I wonder if by commercial you mean direct to consumer, like a 23andMe or an Ancestry.com. Danielle, Megan, would you like to take that?
Sure, I'll take it. I think it's important to balance, not ignoring results like that with not relying on them. So most of those companies say that direct-to-consumer test results need to be confirmed in a medical grade lab. But we can also sometimes find things based on a patient having direct-to-consumer testing, and so it could be important for them medically. So again, just kind of balancing that. Danielle, anything you'd add?
I think that's great.
If you're more involved with direct care to patients, how often are you involved with research studies, or is that mostly for genetic counselors in a lab setting? I know genetic counselors must keep up with new research and studies that come up, but I'm wondering in terms of actually being part of those articles and journals. Megan, Danielle?
Yeah, so I think this is going to be highly dependent on the type of clinical care setting that an individual is, as well as the particular institution and how open they are to those genetic counselors spending their time. For example, Ellen and I both had time that we dedicated to research. We were involved in several different studies, some of which we proposed on our own. And so it will really depend on the structure and the support of the institution. And so that's something that I would encourage genetic counselors as they move on to looking for their first positions to inquire about as they pursue their job opportunities.
And then nowadays there are also people that really like research, so they actually take genetic counseling positions where they solely do research. So I think there are a lot of options.
Great point, Megan. And I would say even when it comes to writing journal articles, a lot of it also has to do with how important it is to the genetic counselor. That is it important enough to you to make time to write those articles? Because it takes a lot of time and effort. Okay, we've addressed direct-to-consumer testing. Could you review cultural competence in genetic counseling and being an ally and effective counselor to minority patients with different experience and backgrounds from you? Megan, Danielle?
I'd say part of it is just being open to the fact that all of your patients are going to have differences and have different experiences, and not making assumptions that you understand based on your kind of different background and lived experience. I think our field and many fields are also getting better at cultural competence training, so that people go into it understanding what their implicit biases might be, so that they're less likely to affect their patient interactions. And just making sure that there's more equitable access to genetic counseling and to other areas of medicine.
When you talked about increasing diversity in the field, you mentioned religious diversity. Could you explain how one could bring that topic up in a personal statement, interview, or application while still being professional? Megan, Danielle? I can jump in. I think in your personal statement, you can talk about the fact that you know that increasing diversity in the field is a major goal of the field of genetic counseling, and that you bring some diversity to the table. And you can either talk about that diversity in general terms, you don't have to be specific, and how you think that will make you a more empathetic counselor. Or you can, talk about it in more general terms and encourage discussion on that during your interview. This is a major goal of our field. So I think just the fact that you know that and you're bringing it up, and that you're showing that that could help you be a better genetic counselor and add something to the field, would be welcomed, in my opinion. With the current pandemic, is there any way we could gain crisis counseling volunteer experience? So we've talked about that.
And I'll also add, just because there's a lot of questions about volunteering, programs understand what a difficult time this is, and all the students applying are in the same boat. So if you do the best you can, programs will understand that.
How accessible would you say genetic counseling is to the average person? I don't know if you mean the average patient or the average person who's looking for this as a career, so I'll briefly assess both. In terms of getting genetic counseling for the average patient, I know that at Yale, we didn't turn away anyone. We didn't turn away people without insurance. We didn't turn people away who were underinsured. And I think especially if you look at an academic university medical center, and many of those, if you don't live near one, you can call and speak to someone on the phone, that it is accessible. As far as you, as a student, is the field accessible? I would say it's becoming more and more accessible. The field is competitive. There are a lot of people who want a spot in a genetic counseling program, but if you can show that you're involved, you're interested, as we've said, there's room in the field. We need really good students. Megan, Danielle, I don't know if there's anything you want to add there.
That's great.
How is the field of genetic counseling dealing with racial diversity to make sure that we know about and able to access this service? It's something we're working on. We know that there are many people of color who have mistrust, for good reasons, of the medical system, and maybe of genetic testing in particular. So we're always working on breaking down those barriers, giving talks in community settings so that people are more aware of the option. There's a huge program right now called All of Us in the United States, which is doing genetic testing and really trying to get more people of color involved in genetic testing and offering them genetic counseling. And that's one reason that we're reaching out to all of you to try and increase diversity in the field, as we think that that will be successful as well. Online volunteer resources for international students. That's more challenging, but I think you'll find that in every country, particularly now, if you do some digging, there are online volunteer opportunities from what I've been able to see on Twitter. Any advice on following up with a GC during the pandemic? I got offered a GCA position. We had an interview 3 weeks ago. Last Monday, I was told that the manager would look over the position. They would let me know, but I wanted to check in because it's been almost 2 weeks since we last spoke, and I didn't want to pester, but know that I'm still very interested. If I were you, I would reach out to them and say, I don't want to pester you, but I'm very interested in the position. And I realize that you and your system may be experiencing some difficult times during the pandemic. And I want to be sensitive to that, but also let you know I'm still interested. I think we're all dealing with that. How can we make genetic counseling more accessible to racial and ethnic minorities as well as immigrants? I think we've touched on some of those things. Educational and training opportunities for international students. Be sure and read through our genetic counseling toolkit that I talked to you about as well. You mentioned that there are fewer genetic counselors internationally. Would you need to go to school in, for example, Europe to be a genetic counselor there, or could you transition with a degree from the US? I actually don't know the answer to that. Megan, Danielle?
I think you can use a US degree to work abroad. I know a few genetic counselors who have, but it's going to depend, I think, more heavily on visa and sponsorship.
Once the pandemic is over, do you see the field of genetic counseling continuing to be more remote and continuing with more telehealth? Absolutely. Are there benefits to having patients come into the clinic? I think there are benefits, but I think there are also disadvantages, as we've seen. The benefits are that in person, I find it easier to make a connection with patients. And I think sometimes they feel that way as well. But in terms of the advantages, by doing it by telehealth, we can reach more people, and people don't have to take time off from work. They don't have to travel. It costs them less. They don't have to pay for childcare and parking. So we hope that it makes it more accessible. I've read in some forums about genetic counseling moving to a PhD in the future versus a terminal master's degree. Is that true? If so, how would it work for those of us who graduate with just a master's degree? I guess I would say that now the standard of care or the standard of practice is definitely a master's degree in genetic counseling. There are some people, it's by far the minority, who get a PhD. But at this point, those people often go into research positions, not always. But at this point, the standard of practice is a master's degree. Danielle, Megan, I don't know if you have anything to add.
This has been formally discussed in the field, and one of the challenges is supporting a third year. On the one hand, it would give us more time to teach students because there is so much to learn, but it would be harder to support that third year logistically and financially, and then you'd have people supervising PhD students who don't have a PhD themselves. So overall, the field has said we're not ready for this yet, although there are some programs beginning to offer PhDs. I think much of the discussion also circled around the fact that we're doing a good job of taking care of our patients and doing other roles with a master's. So I hope it wouldn't look to someone being looked down on. And I also think if it transitioned to that, they would start to offer bridge programs for those who want to transition from a master's to a PhD.
The next question is, how are schools making their GC programs more accessible to minority students and students with disabilities? I think that might be a good question for the training program directors about how each of them are doing that, but I can tell you that they are all interested in having a more diverse student population. Someone here points out, and I think it's an excellent point, that volunteering is not an option for everyone. It's very much a privilege to have access and ability to volunteer, and that is a fantastic point. I'd also like to point out that volunteering doesn't always mean 20 or 40 hours a week, that if you're not able to volunteer full-time or even part-time, you could volunteer even a few hours a week for people for whom that's an option. But I think it's a great point that a lot of people need a paid position and that we need to keep that in mind. Please keep in mind that some universities and colleges and even community programs will pay you to do a volunteer activity. More and more of those programs are becoming available. So ask if you're in college or a university, ask if they have any pay to volunteer programs.
And some of it's more about the experience that you're getting. So you could seek out job opportunities where you're working with populations with health conditions or advocating for people. So it's not necessarily that it's unpaid that makes it a valuable experience. It's what you're learning and the people that you're being exposed to and the experience that you're getting.